I'm gonna read an article about fi- physical distancing, face mask, and eye protection to prevent person-to-person transmission of SARS-CoV-2 and COVID-19, a systematic review and meta-analysis. Introduction. As of May 28, 2020, severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 has infected more than 5 million individuals worldwide and caused more than 3,000 deaths. Emergency lockdowns have been initiated on countries across the globe, and the effect on health, well-being, business, and other aspects of daily life are felt through societies and by individuals. We know effective pharmacology intervention or vaccine available in the immediate future, reducing the rate of infection and flattening the curve is a priority, and prevention of infection is the best approach to achieve this aim. SARS-CoV-2 spreads person to person through close contact and causes COVID-19. It has not been solved if SARS-CoV-2 might spread through aerosols from respiratory droplets. So far, air sampling has found virus RNA in some studies, but not in others. However, finding RNA virus is not necessarily indication of replication component and infection component viable that the virus could be transmissions by aerosols. Evidence before the study. We searched 21 databases and researchers from inception to May 3, 2020, with no restriction by language for a study of any design evaluating physical distancing, face mask, and eye protection to prevent transmissions of the viruses that causes COVID-19 and the related diseases. For example, severe acute respiratory syndrome (SARS) and Middle East respiratory syndrome (MERS). Between infected individuals and people close to them, for example, household members, caregivers, and healthcare workers, previous related meta-analyses have focuses on randomized trials and report impressions data for common respiratory viruses, such as seasonal influenza, rather than a pandemic and epidemic beta coronavirus caused of COVID-19. Added value of this study. We did a systematic review of 172 observational studies in healthcare and non-healthcare settings across 60 countries and three continents. 44 comparative studies were included in meta-analysis, including 25,000 patients with COVID-19, SARS, or MERS. Our findings are that the best of our knowledge to first rapidly systematic and direction information of COVID-19, and therefore provide the best available evidence to inform optimum use of three common and simple interventions to help reduce the rate of infection and inform non-pharmaceutical interventions, including pandemic migration in all healthcare settings. Discussion. The findings of this systematic review of 172 studies on COVID-19, SARS, and MERS provides the best available evidence that current police of at least 1 meter physical distances are associated with a large reduction in infection, and distance of 2 meters might be more effective. This data also suggests that the wearing face mask protects people, both healthcare workers and the general public, against infections by this coronavirus, and that eye protection could confer additional benefit. However, no one of these interventions afford complete protection from infection, and their optimum rule might need more assessment and several contextual considerations. No randomized trials were identified for these interventions in COVID-19, SARS, or MERS. Outcome. Outcomes of interest were risk transmissions, WHO defined confirmed or probable COVID-19, SARS, or MERS, to people in healthcare or not healthcare settings by those infected, hospitalizations, intensive care, unit admission, death, time to recovery, adverse effects of interventions, and contextual factors such as accessibility, feasibility, effect, and equity resource considerations relate to the interventions of interest. However, data were only available to analysis interventions effects for transmissions and contextual factors. Consistent with WHO studies generally define confirmed cases with laboratory confirmation with or without symptoms, and probably cases with clinical evidence of the respective infection suspect to be infected, but for whom confirmatory testing either had not yet been done before any reasons or was inconclusive. Role, role of the finding sources. The funder contribution to define the scope of the review, but other advisors had no role in study design and data collection. Data were interpreted and reported, drafted, and submitted without funder input, but according to control agreement. The funder provided review at the time of final publication. The responding author had full access to all data in the study and had responsibility for decisions to submit for the publication. Results. Results. We identified 1,070 studies for our systematic review for 60 countries across 4 continents. Studies were all observational in nature, no random trials were identified or many interventions that directly addresses the including study population. Of the 1,072 studies, 66 focuses on how far a virus can travel by comparing the associations of different distance on virus transmission to people. Of those 66 studies, 5 were mechanics assisted by RNA virus or both cultivated from the environment of non-infected patient. Thank you.